Sunshine, it's our sunshine.
Hello, this is Dr. Rajeshwari. I work as a full-time consultant in Sunshine Hospitals Gachibowli. So today we are going to talk about breastfeeding. So breastfeeding is a very natural process which I feel comes to the mothers very naturally. So first question most mothers ask me is, when is the ideal time to start breastfeeding? The ideal time would be as early as possible. Usually we start breastfeeding within the first 1 hour of delivery. What are the uses of breastfeeding? Breastfeeding is the natural nourishment to the child and the best nourishment to the child. It has all the ingredients like vitamins, carbohydrates, proteins and water in the right amounts that are required for the child. The first time you feed the baby, usually it is a yellowish thick discharge which is called colostrum, which is supposed to be full of antibodies. So it helps the baby to build natural immunity. So when we talk of breastfeeding, that is nourishing the baby, breastfeeding is about bonding with the baby, nourishing the baby. The patient is advised to have skin to skin contact with the baby. So it's very important to keep the baby very near to the mother. So when you have to start feeding, the first and foremost thing that you have to be particular about is you should be in a very comfortable position. It could be sitting position or it could be lying down position. The most commonly used position in Indian scenario, cradle hold method. So each time the baby feeds like about 15 to 20 minutes on each breast. It's very important that you feed the baby on both the sides of the breast, and if you feel that the baby is stopped feeding or is falling asleep, then you could lightly touch the face on the part below the ear and wake the baby, or you could just tap the foot of the baby and wake it so that it will again start feeding. So when the baby has finished feeding on both the sides, it's very important to put the baby on the shoulder and wait till the baby burps. So this is the most common Indian way of feeding. So there are other methods, which is the cross cradle method. What we tell the patients is that they hold the baby with one hand. Suppose if they are feeding the baby on the left side, then they hold the baby with the right hand, and the left hand is free to position the baby's mouth to the nipple. So that's the second. And then the third method is the foothold method. Suppose you want to feed on the left side, then you place a pillow next to your left breast perpendicularly, and then you make the baby lie down and feed it. So the baby foot is like behind, baby is lying on your side and you are feeding from the side. Another method is by lying down. When the baby is lying down, you put it on the side to which you want to feed the baby and use your opposite hand to place the nipple in the baby's mouth, and make sure that the breathing for the baby is free. So a lot of people keep asking me questions when I have cough and cold, I have viral fever, should I feed? So any kind of fevers like dengue, malaria, typhoid, gastroenteritis, throat infections, cold, cough, none of these are contraindications for breastfeeding. Even breast abscess is not a contraindication for breastfeeding. So one should ideally continue exclusive breastfeeding up to 6 months of the baby's life, and after 6 months you slowly start weaning them with liquid food and semi-solid diet, and after 1 year you can decide, depending on the baby situation and your own health, can decide whether you still want to continue feeding the baby. So we as gynecologists encourage every mother to breastfeed their baby, and that's the best thing you can do for your baby.
Sunshine, it's our sunshine.